There are practical considerations in the ways that you can introduce cannabis into the body. Cigarettes, cigars, and pipes are basically combustion of marijuana with transmission of the product through the lungs. Hence, patients are at risk of increased inflammation to the lungs and bronchi, causing chronic bronchitis. Increasingly, this is becoming a less popular method of administration. There are other types here that are described to essentially show completeness, but the most common ways that patients are introducing marijuana is through oil extracts, as they are in capsules or can be mixed into foods, as well as vaping, which is essentially taking a solid, heating it to a specific temperature, and having that aerosolized and then inhaled. And that has a potent ability to transmit the THC and CBD directly into the body through the lungs. What do patients experience when seeking medical cannabis? And this experience may vary by state and individual dispensing facilities. Some may have the options of certification through telehealth physicians. One example is HelloMD. This is a cash transaction, and mainly this is because federal law, again, does not recognize a role for cannabis medically, and hence national insurances will not reimburse for this type of a visit. Often, this means out-of-pocket costs for the patient. Dispensaries are typically nondescript buildings which are visited once a patient in a state that allows medical marijuana to be used presents with a proper certification and are addressed by different representatives within the dispensary, including a personal care representative. Sometimes this may be someone with additional training in the products and the effects of marijuana, and sometimes can be a pharmacist with additional training in marijuana products. It's unclear who's responsible for counseling regarding use of this product around work and travel, as again, different states have different laws, and each workplace may have different rules permitting cannabis use. Currently, there is no insurance coverage for using cannabis, even in a medical, even with a medical intention. There is always special attention paid to young women of reproductive age, in women who are pregnant, and in women who are breastfeeding. We know that there is some data that suggests decreased fertility in males and a decreased frequency of menstrual cycling and endometrial proliferation in women. The American College of Obstetrics and Gynecology does not recommend or endorse the use of cannabis because observational data suggests low birth weight infants, preterm delivery, although more recent data suggests that some of this is complicated by concomitant tobacco use. However, the position of these societies has not changed. With regard to breastfeeding and lactation, THC can be detected in the breast milk up to 6 days after last use of marijuana, that the concentration will be related to the intensity and frequency of maternal use of marijuana, and that there is evidence, negative evidence, of influencing brain development in young children. And so this is typically considered to be a contraindication to cannabis use during this time. What are the pediatric considerations? Well, there's literature that supports the view that the use of cannabis in the pediatric population has negative health effects, both short and long term, with regard to neurologic development and disorders of the nervous system, with regards to cognition and being able to have proper judgment, having it affect memory and reasoning and perception. In patients who have an underlying tendency towards schizophrenia, it can uncover hallucinations and or schizophrenia. In patients who especially combine it with alcohol, there has been an increase in motor vehicle accidents. The addiction risk is known to be greater in adolescents who are exposed to marijuana and may predict progression to other drugs. And finally, the Academy of Child and Adolescent Psychiatry and the American Academy of Pediatrics opposes the legalization of cannabis. There are employer and school considerations, as we mentioned. Private employers may conduct drug testing, and laws will vary by state and how it affects your ability to become employed or stay employed. Pre-employment screening is quite common, and testing current employees, although is less frequent, but possible. State laws generally do not protect employees from being fired for use of cannabis, even for medical reasons. Schools must continue to comply with obligations to prohibit the use of illicit drugs under different statutes, and state laws vary on allowing the use of medical cannabis by minors, although this may vary by state law. Summer camp considerations: camps may refuse to accept campers using medical cannabis, even in states where cannabis is legal. The status as a camper or camp employee is not protected. And if traveling out of state for a camp, remember that transportation of cannabis between state lines is considered illegal. State laws vary on medical cannabis when traveling or moving, and patients should understand the laws of the state that they're in and the state that they may travel to. The National Coalition of State Legislatures maintains a list of each state and the date of ratification and details of the law. The website is listed below. Crossing state lines can be a problem and can be prosecuted under federal law. The TSA, again, when you're traveling through an airport, does not allow medical cannabis in checked or carry-on bags and prohibit all types of cannabis products, including CBD oil. Remember that once you pass a checkpoint, you are on federal property. The Crohn's and Colitis Foundation has developed a position on medical cannabis, and the foundation supports policy changes that facilitate the conduct of clinical research and the potential development of cannabinoid-based medications, including further consideration for revising marijuana's status as a federal Schedule I controlled substance. With regard to cannabis, why is there so little human data? Researchers face several challenges when studying cannabis, which again is a Schedule I drug. The Department of Justice has a hands-off approach to medical cannabis, but that status is not guaranteed and depends on the political status. Funding is difficult and limited, and for universities receiving Title IV federal funding, they are required to keep their campuses and schools free from marijuana possession, using, or distributing, which again limits their ability to study this drug. Researchers who want to conduct scientifically designed interventional studies have even more hoops to jump through. The National Institute on Drug Abuse contracts only with the University of Mississippi to supply cannabis for human research studies. The researchers need to have a special FDA application called an IND, a Schedule I DEA researcher registration, an institutional review, and a State Board of Pharmacy approval. The Crohn's and Colitis Foundation has supported several cannabis studies, and there are 3 studies detailed here that are currently underway. The first is studying the role of gut bacteria in mediating the communication between intestinal and immune cells via internally produced cannabinoids. The primary investigator is Rose Body at the University of Massachusetts Medical School. The second study is characterizing the biological events induced by cannabinoids in anti-inflammatory immune cells by Colm Collins at the University of Colorado in Denver. Finally, a private academic collaboration with Molecular Infusions, the website is listed, is going to explore the pharmaceutical standard measures of cannabinoid therapeutic application in a preclinical research and development phase. To summarize, a large percent of IBD patients have used or are using cannabis to manage IBD-related symptoms. Studies have shown some benefits for symptom improvement with cannabis use in IBD. However, no studies have shown significant impact on disease activity specific to inflammation whether measured as biomarkers in the blood or stool or measured as colonoscopic improvement. Some studies do show a possible risk with use, and most commonly this is a discontinuation of standard medical therapy, which may lead to flares and or disease worsening. It's important to discuss cannabis use with the healthcare provider, and it's critical not to stop conventional medical therapy. And clearly, given the limited amount of human research that's available to date, more studies are required. We would like to thank the contributors who helped create this slide deck, including Dr. Jamie Kanukin at the University of Michigan and Dr. Derek Patel at University of California, San Diego. We'd also like to acknowledge and thank the contributors and co-authors on the Crohn's and Colitis medical cannabis position statement. They're listed below.